attention deficit disorder. There are 5 types. Let's first start with amphetamines. What are amphetamines? It's an old molecule. The amphetamine molecule goes back to pre-World War II. The amphetamine molecule consists of levoamphetamine and dextroamphetamine. They took that molecule, and it consists of a left and a right, and they're different because they are made of the same components, but the molecules occupy different positions in space. It's called isomers. So you have a left and right. They're not exactly identical, but look, they're very similar. So they took the amphetamine molecule, the levoamphetamine, the dextroamphetamine, and they split the molecule. They took dextroamphetamine, which is the more potent active molecule. Okay, so dextroamphetamine is used to treat attention deficit disorder. It's called Dexedrine. Then they took that molecule and they added a methyl group, and that became methamphetamine, Desoxyn. Then they found that they could make a prodrug called lisdexamphetamine vyvanse. When it goes to the liver, it is metabolized into dextroamphetamine. So you have the amphetamine molecule, you have dextroamphetamine, you have methamphetamine, and you have lisdexamphetamine. Okay, there's a lot of different names. The amphetamine molecule itself, the mother of all of them, goes by different names. I've heard names like Dyanavel, Evekeo, Adzenys. Those are just slower release forms or brand names where they manipulate the pill so the drug is released slower or faster. So it's not very confusing. So there are 4 types of amphetamine. The most common one used is Adderall, which is an amphetamine salt. So it's the amphetamine molecule, which has levoamphetamine and dextroamphetamine. Other brand names for the pure amphetamine molecule: Dyanavel, Adzenys, and Adderall, Evekeo. Okay, so we got that. Amphetamine. How do amphetamines work? I'm not going to bore you. The nervous system works electrical, presynaptically. There's a neuron. It sends out a chemical. So one neuron, and there's 100,000 here, goes electrical signal, releases neurochemicals, norepinephrine, dopamine, serotonin, stimulates 100,000. So it goes electrical, chemical, this is the intersynaptic cleft, stimulates 100,000 neurons. It makes sense because the exponential action potential is created from one neuron going from electrical to chemical, so on. So what it does, this would be one presynaptic, this would be 100,000. So right here we have the axon terminal. What amphetamine does, it stops the reuptake pump, possibly reversing it to pump dopamine, norepinephrine, and serotonin back into the intersynaptic cleft, where it then could act on the postsynaptic neuron. It may cause vesicles to go to the cell membrane and release dopamine, norepinephrine, and serotonin, and also it may decrease the breakdown of norepinephrine, dopamine, and serotonin, thus increasing the intersynaptic cleft where these neurotransmitters can potentiate action potentials in the postsynaptic neuron, blah, 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 blah. So you get that. It increases the amount of neurotransmitters that are available to act. It doesn't increase the amount, but it just prevents their reuptake, their breakdown, and it potentiates their release so they can act. Okay, so that is one class, the amphetamine. The next class is stimulants. What are stimulants? Stimulants are very similar to amphetamines. The stimulants are methylphenidate. That was the primary stimulant, which all other stimulants are based. It's called Ritalin. There's a slow-release form of Ritalin called Concerta. There's another slow-release form of methylphenidate called Ritalin long-acting. You can get Metadate, which is a mixture of slow-release and immediate-release methylphenidate, which is Ritalin. Get this, there's one, Jornay, you take it at night, and it's a form of methylphenidate that doesn't activate till the next morning because the pill slowly releases it. What other stimulants are there based on the methylphenidate molecule? Well, there's dexmethylphenidate, Focalin and Focalin long-acting. It's called dexmethylphenidate. So we're still in the stimulant class. We talked about the amphetamine class. There were 4 types. There are 3 types in the methylphenidate class, the Ritalin class. Methylphenidate, dexmethylphenidate. What is the third one? Dexmethylphenidate. It's a new drug. They took the prodrug of dexmethylphenidate, and when it goes to the liver, dexmethylphenidate asterisk, that's the name of the brand name. It goes to the liver, it gets broken down to dexmethylphenidate. Okay, so I've talked about 2 classes. The amphetamine class, which everyone knows is Adderall. There are other names, Dyanavel, Evekeo, Adzenys. Okay. Vyvanse, Dexedrine, Desoxyn, methamphetamine. Those are the amphetamine. Then I talked about the stimulant class, the methylphenidate. And the members of that class are brand name-wise Ritalin, Focalin, and asterisks, which is methylphenidate, dexmethylphenidate, and dexmethylphenidate. Okay, those are 2 classes. The third class I group into the antidepressant class. The antidepressant class is used to treat attention deficit disorder. The first member of that class is atomoxetine, brand name Strattera. It is known to increase norepinephrine in the frontal part of your brain. Okay, didn't work that well. Strattera, atomoxetine, but it's not addicting. It's a good time for me to talk about amphetamine and stimulants. What do? Well, as a class, they make you more alert. They make you move around more. They make you more sexual, and they make you have decreased appetite. It's great. Those are the good of amphetamine and stimulants, but they can also cause dysphoria, sadness when they wear off, irritability. They can cause tics, headaches, trouble sleeping, decreased appetite, delays in growth, headache, teeth grinding, tremors. All right. Addiction, euphoria. All right. What are the other antidepressant-like treatments for attention deficit disorder? I talked about Strattera. There's another one called Quelbre. That's the brand name for viloxazine. It's a norepinephrine reuptake inhibitor. Unlike the amphetamines and the stimulants, the Adderall-like drugs and the Ritalin-like drugs, this drug just increases norepinephrine. By increasing this monoamine, the monoamines are norepinephrine, dopamine, and serotonin, it increases a particular monoamine called norepinephrine in the frontal lobe, hopefully helping people focus, stay on task, be organized. It's okay. It's an old drug. It's new to the United States, but it's been around like 40 years. I did a video on it. You can go watch it. The third drug is bupropion, Wellbutrin, also called Zyban. It works okay, nothing great. The best drugs, in my opinion, are the amphetamines, then the stimulants. Then we could go to the antidepressant type drugs. What is the 4th class? The 4th class, believe it or not, are antihypertensives, drugs that lower blood pressure. Capve, clonidine. Clonidine is a drug that acts on the flight or flight system in the body by blocking it. It blocks the alpha-2 receptor, which is inhibitory, And when you do that, it has a calming effect. Clonidine, Capve has a calming effect on the frontal lobe, helping people focus. Does it work as well as amphetamines or stimulants? Does it work as even well as the antidepressants used in attention deficit disorder? I would say no. It has some value. It's short acting. You need to give it multiple times during the day. It can lower your blood pressure. The benefit of these are non-addicting, non-habit forming, just like the antidepressant drugs on the treatment of attention deficit disorder that I mentioned. Strattera, atomoxetine, Quelbre, viloxazine, bupropion, which is Wellbutrin or Zyban, those are not addicting. These drugs I'm talking about, the antihypertensive class, are also not addicting. Clonidine, Capve, and guanfacine, and Tuniv, which is another member of this class. It's just longer acting. It blocks a receptor, the alpha-2 receptor, in the flight or flight response, the adrenergic system, and it helps by calming the brain down. They don't work that well. They do okay. The fifth class, this is not indicated. This is just my personal use of this drug. There are two classes in this drug, Provigil, modafanil, and Nuvigil, modafanil. They affect the dopamine transporter pump, increase dopamine, and that's a similar mechanism to the amphetamine and the stimulant class. They can help with attention. They can help with mood a little bit. This class is not indicated for attention deficit disorder. It's used for shift workers, narcolepsy, sleep apnea, because they help you stay alert, stay focused. They can also be used as adjunct treatments in depression. There's research on that, and they can be used in attention deficit disorder. So I've discussed the 5 classes. The amphetamine class, the most common member being Adderall. The second class being the stimulant class, the most common member being Ritalin or methylphenidate. The third class being the antidepressant type would be the Strattera, atomoxetine, bupropion, Quelbre, which is viloxazine. And I discussed the fifth class, which is my personal class, would be Provigil and modafanil and Nuvigil or modafanil. So these are the 5 classes. This is mostly for my patients, so I have to keep giving this talk every time I talk to someone. But that is the most up-to-date treatment for attention deficit disorder. I appreciate likes, subscribes, comments, most appreciated. Shout out to the United Kingdom, Canada, and Australia, the US. That's pretty much everyone who watches my video. I'd appreciate people buying my book on Amazon.com, Tales from the Couch.